There we go. Okay. Share my screen again. So last week we talked about swallowing. So just a quick review. Remember, you guys as SLPAs are not licensed to do any swallowing therapy or feeding therapy. I wish they would call it swallowing, not feeding. But if you're ever uncomfortable or things are questionable about purpose of certain activities or goals you're addressing, please have that conversation with your supervisor. So yeah, state of Arizona, you're not licensed to do swallowing, and typically they'll just call it feeding. So as I discussed before, oftentimes though, you will be treating them for other comorbid speech and language issues so that you are licensed to treat. So remember, when in doubt, talk to your supervisor if you're at all worried, because ethically it's a big deal and you don't want to ever lose your license. Don't do that. So voice, so a couple different things. So there is a voice observation. Oh gosh, I should have double checked and make sure that client's still on master clinician. I will double check and be sure that they are still available. And then a voice disorders assessment. So somebody asked, what's on the quiz? Basically a lot of vocab and just some of the key pieces of voice disorders. So go to the read and review page. So these are some videos where we talk about hoarseness, vocal fold nodules, vocal polyps, vocal cord paralysis. These are all things that you will see, especially when you're working like adult skilled nursing facility or rehab hospital, vocal cord paralysis, as well as laryngeal cancer. Definitely are some various things that are, and I don't want to say you'll see a ton of it, but it's common, especially if you work with the adult population. So these are just kind of some little quick videos for you to kind of get an idea of that. Now, another one that's kind of different is spasmodic dysphonia. There's some, oh gosh, I can't think of her name. There's someone who's popular on NPR that has it. I don't listen to NPR, so I don't know, but usually someone always does in the class. So definitely the other part, voice disorder for puberphonia. And basically, usually if they have that, they're not necessarily when we might see it. Usually we should be doing a referral. It's more like psychogenic. So it's kind of where they're not using their mature voice, they're using their immature voice for some reason or another. There's some kind of gain they get out of that. So definitely those are some things that you'll see in a voice clinic. So let me just review what are voice disorders. So basically, when we're talking about voice disorders in a general sense, we're not treating the singer to hit the high C or anything like that. You will see singers, you'll see people who we would say engage in vocal abuse behaviors, coaches, teachers, another big group where they do a lot of vocal abuse, so to speak, or use their voice in unnatural ways that strain it. Our adolescent population, cheerleaders are at high risk for this. Any person who's yelling on a regular basis definitely can have some voice issues. So a voice disorder can be defined as a problem involving abnormal pitch, loudness, or quality of the sound produced by the larynx. And we might refer to as the voice box. That's like kind of the layman's terms. And some of the major symptoms that we see. So hoarseness, extended hoarseness, not because they're ill, is a big thing. Limitations in pitch and loudness, definitely some challenges for certain clients for a variety of reasons. If you are a professional singer, so a lot of actors, actresses, theater people can have this issue. And voice voice can occur with both adults and with children. So definitely, like I said, prolonged hoarseness is one of the biggest symptoms, shortness of breath, and then like a harsh or rough voice, and then breathy voice, decrease in pitch range. So sometimes kind of where people don't have a lot of variation in the pitch, decrease in loudness, deterioration of the voice as the day goes by. So I have treated a child who's now gosh, he's almost going to be 18 here real quick. He was one of my first kids in a school-based setting that came with an actual diagnosed voice disorder. In fact, and I've known his mom now forever. We were talking last year, and, he's a senior now. He went back to the ENT. The ENT recommended, he recommends, usually an ear, nose, and throat specialist recommends like a set amount of sessions. And I did do them at school, and I added it to his IEP. I've done that a few times. Give myself a range of, he needed to, I think the ENT wrote last time 8 to 10 sessions. So I put 10 sessions on his IEP, and I did it with him at school. And he has one where he'll be talking, and all of a sudden it just is he's aphonic, meaning he cannot get voicing. It's like he just really, especially at the end of sentences too, sometimes he'll lose his voice, and it seems like it takes him a minute to regain it. So we do a lot of review of some various things. Now, typically speaking, the ENT wrote what he needed to work on. So, he's the one that examined the vocal folds, cords, sorry, I'll say vocal folds. Midwest, I think they use folds more than vocal cords, but same thing. So usually the ENT is the one that diagnoses and then gives that treatment plan. And then the speech therapist is the one that kind of follows through with that therapy for it. So that's kind of a little bit difference in voice disorders. An SLP might be a part of that assessment, especially an SLP that works in the ear, nose, and throat specialist office. There are a lot that have SLPs on staff. And, what are some things that would work for this particular client? And various things do work. And usually the doctor has a good kind of plan in place. So, some of that increasing, like a strained vocal voice is definitely something else that kind of alerts us. Tension in neck muscles. And really, when we see problems with the voice that last for an extended amount of time, I definitely found out too, just being aware of how much I can do some vocal abuse behaviors. Gosh, when I'm on Zoom, I'm always like, my husband's like, you're yelling. I'm always loud. I don't know why, but I definitely can hear it in my voice at the end of the day if I've been on Zoom all day. So generally speaking, what is an SLP? What do a speech therapists know? We kind of understand like how our voice is produced, and then kind of those strategies to optimize that production. So definitely some things. So you can kind of look at some of the causes, but an awful lot is caused either by something, what I would say, something like laryngeal cancer, some lesion, something related to the vocal cords, or just someone who would engage in vocal abuse, or someone who uses their voice a lot, like a professional singer. You'll hear every now and then you'll hear a singer who has like vocal nodules. What's hard about that, the only way to get rid of them is to not use your voice. So definitely there's some challenges there for somebody who's like a professional singer who has, but it definitely changes the quality of their voice, as well as those nodules can add weight and kind of change their pitch, and they might have difficulties with pitch ranges, those kinds of things. So definitely a lot of what we do as therapists with regards to voice is work on what we call vocal hygiene. So really what we do, and oftentimes they'll have other medical treatment. So it's probably a nice working relationship with the medical piece as well as the therapy piece. So a lot of therapy with regards to voices how do we reduce those vocal abusive behaviors? So a lot of what we work on is changing the environment. So, you know, humidify the room, reduce your caffeine intake, but that's easier said than done for sure. Keep your vocal folds moist. So we talk a lot about, and then like steaming. Gosh, you're ever hoarse, go sit in the steam room at the gym for, you know, a few minutes. That usually will help definitely increase the moisture in your vocal tract. So we definitely work on how do we alter the environment? What are some things we could do to support our voice, as well as what are things that we do on a regular basis that kind of detracts from our voice? So too much caffeine, not drinking enough water. What are things we do that strain? So I know for me, one thing that I do, and I can definitely tell sometimes, is, so we have a 2-story house and I have 4 children, and just the yelling up and down the stairs. So now I've been really working with my kids, because you know, my husband's like, everyone's yelling, and yes, he's right. And that's not good for anybody. So, not your mental health, not your vocal health, nothing. So I've been trying to work with my kids about not screaming down the stairs. Like if they want to talk to me or they want to ask me a question, they need to come down and, you know, talk to me in person. And, you know, or something else too. I have a particular client I saw in a clinic for a long, long time when I worked in a clinic. He did a lot of what I would call abusive behaviors with his voice. So, you know, he did this like weird thing where I can't even recreate it, but it's like, he didn't just like clear his throat. He did, I don't know, it's like a gargle thing. Definitely was very abusive, and it really detracted from his voice quite a bit, along with other things. And we definitely see clients. So it makes me think of this client, and I have a couple of others who have a diagnosis of autism. And they have what I would call some other different behaviors for a variety of reasons. And I think his wasn't, so we just try to work on like awareness. When are you doing it? Is there something that triggers that response? Because I think he did it in like stressful situations from what I could tell. And I remember problem solving that with his mom, because then when he would talk, he had limited language, but he could talk and he could respond. It was very hard to understand him because the quality of his voice was not great. So his, you know, he could say the words fine. He didn't really have an artic issue. It was more about his vocal quality. So yeah, throat clearing is not a gentle movement for your vocal folds. Definitely not a good thing to, it is, if you do it habitually, it's very abusive and can be damaging to your vocal cords. So yeah, shouting or talking about background noise definitely puts strain. You know, if you're working. So I actually, myself and my co-therapist, were pretty big proponents of encouraging our teachers. So all of our teachers at our school have a smart board, or I don't know, they're called different things, a Promethean board. I can't think of something else. We call it a smart board, but you know, one of those electronic, and most of them have amplification already built into it. So we do a little thing at the beginning of the year where we work with our teachers about, hey, use this. This is great. Not just when you have a student with a, you know, hearing impairment, all the kids benefit from amplification. You're not straining, you know, especially I think kids just turn and listen when it's amplified a little bit. So without straining your voice. So definitely some things that we work with our teachers, because teachers are a big client base that do a lot of vocal abusive behaviors or allergies. So anybody who has, and you guys, and I can hear it too in my own voice. If you have an allergy, you can kind of hear it. You definitely know it's impacting you. And those are things too, where you work with your doctor about, you know, allergy management. What are some other things you do to help your whole vocal tract, those kinds of things. So definitely, what are some other things? So someone who smokes, guess what? It's not helping your voice. Definitely one of the worst things you could do to help your voice is smoke, not to mention your health in general. So and vaping. So I have seen this, and I don't think vaping's been out enough that we see really good stuff related to speech and language. but I have definitely noticed some kids, especially my high school age group, who vape. I do think it impacts their vocal tract more than what we even know right now at this point. So definitely some things there. After working with a few of my adolescents, kind of problem solve some things. So definitely, you know, a lot of what we do in therapy isn't necessarily about how to make your voice better. It's about how to improve the environment so you don't have to strain your voice, or how do I change my environment so I have, I can give myself my optimal voice, those kinds of things. So a lot of therapy is more what I would call kind of more that behavioral kind of thing versus something straight. There are some vocal function exercises and things that we do directly with the voice, but those aren't recommended on a regular basis. That's for a very few and specific. Let's talk about preferred practice. So there's some great links on these links on here if you want to learn more about them. I definitely like Voice Foundation, Voice Problem, so voice intervention. So I don't talk a lot about some kind of a more up and coming, if I want to say that in that way, but what I would say, there is a bigger reach out for speech pathologists about transgender. We're not going to talk about transgender in, I think it's in 242. Where did we put it? But we added it recently in some updates about transgender voice therapy. So for women who take male hormones, obviously that changes their vocal tract based on their hormone. But for a male that's transitioning to female, kind of working on some of those more feminized or stereotypically more feminine speech patterns or voice patterns, there is a bigger clientele, and finding therapists who are well versed in that, who understand that, and can provide appropriate services for that. So that's kind of a newer up and coming area that's seeing more of a need. So really what we do, what do we do? What do we do for someone who has a voice disorder? So what we're looking at, we're usually part of a collaborative team. So typically speaking, we're working with a medical professional of some type, usually an ear, nose, and throat specialist, as well as the individual and the family. So it's kind of what I would say more of that collaborative approach to therapy, and definitely look at, what's going to be to their advantage, how do we maximize it, and then definitely about reducing barriers. So sometimes identifying when they are engaging in these behaviors, and obviously when we're looking at something like someone who's had a laryngectomy and they've had their larynx removed, there are some different voice things we do depending on what kind of voice output they're going to use. Like there's the TP, there's the electrolarynx, that kind of thing. So we definitely kind of work on some of that aspect too, depending if that's a need for them, as well as even if they have what I would call an artificial larynx of some type, we usually also have to work with them on how to maximize their vocal tract. Definitely some of these things still apply to them, hydration, having some humidified air, definitely some of those factors impact them even more. So, and really what we're looking at is, by therapy, we're not necessarily always expecting our voice to be back to where it is, but we're working at like improved functioning, improved participation, as well as, do we need other referral services? Do we need to go back to the middle? Hey, we've modified the environment, we've done these things, and I'm still having difficulty. So definitely some kind of what I would call that dynamic. You might come to therapy for a little bit. Like this kid, I've had him since he's been a first grader, off and on since now that he's a senior. And has he had voice therapy the whole time? No. Does he have some other things that definitely impact him? Yes, but you know, that's being medically managed. So we definitely work on some of those things at various times, and then it changes too. Sometimes what's nice is they improve one thing and then something else goes on. So definitely voice therapy is usually what I call the dynamic assessment all the time. And, you know, I don't feel like it's a big disorder that we work with, but what I was telling, I have a graduate intern from ASU right now. I was telling her I have a couple of kids with some very strange vocal quality, and I keep bringing it up at meetings. And since I can't see their larynx and I can't diagnose a voice disorder, I'm always waiting for them to go to see the ear, nose, and throat specialist about their tonsils and adenoids here. But definitely some things that, you know, hopefully we can help, but oftentimes we need other medical information before we know if we could be effective. 9 times out of 10, though, I'll tell you this, it's usually helpful for everyone to be drinking more water, and usually helpful for everyone to reducing their caffeine. So when in doubt, you know, you can always encourage someone to drink less caffeine, drink more water for their vocal health. As I was telling, because the therapist like, well, can't we do this? I was like, well, I need to have clearance from it. You always, before you do any kind of voice therapy, we always need to have clearance from an ear, nose, and throat specialist. But what I was telling her, we can always support proper vocal hygiene for everybody. I mean, that's just a kind of a basic. It's kind of like, hey, let's promote, you know, health factors like getting exercise, getting enough sleep, you know, drinking enough water, and, you know, not smoking, or kind of, I don't know, I would say basic health guidelines. So let me go to this presentation real quick before we sign off. Now, there's a lot of information on here, and there's a lot of what I would call redundant information in this week's read and review. And it's kind of, you know, this is good. This is a good review of the Bernoulli effect, like how do we get voice? So just a couple different things too I want to point out. So when we talk, we inhale, we usually talk on the exhale. Sometimes we see in voice, for a variety of reasons, they're talking on the inhale versus exhale. So we definitely sometimes see some of those challenges. And sometimes where I see it first is it shows up in articulation issues. And then I notice there's a lot about their breath and the way they're using their system to produce sounds in a variety of ways. So definitely see that, you know, it's the air exhaled that kind of vibrate the vocal cords. So those just kind of a key piece I wanted you guys to be clear on as an SLPA. And then obviously the sounds, you know, it produces the sound at that level, and then the sounds is shaped by the rest of the mouth, lips, tongue. So it's kind of, those pieces are the filter for the sound. So definitely we do know any kind of swelling, irritation, infection can distort our voice. We know that. I'm sure all of us have had that. Here is just some, what would it look like visually? Definitely we see some things that can occur. So vocal cords, and this always can look a little, it's like, what is that a picture of? Yep, vocal cords. So definitely kind of what we also do is sometimes people have issues with voice and they go and see a speech therapist, but they really should go see the medical. So us as professionals always need to be referring people to go see an ear, nose, and throat specialist. Definitely not just your primary care, definitely an ear, nose, and throat for anything related to voice, respiratory, that type of thing. So temporary hoarseness. Now, we do see some kids who have chronic respiratory issues. So asthma, that's one. I'll see sometimes we'll see sometimes our tic issues just because of their breathing patterns. Definitely some things. So asthma, and why can't I think of the other one off the top of my head? I don't know why that just escaped me. Asthma, allergies, Definitely those are two things that kind of, when we know they have that medical issue, definitely something they need to be talking to their doctor about. Cystic fibrosis, right? That's a lung issue, any lung issue. There's another common one I can't think. Anyway, COPD. So sometimes we'll see adults who have stuff and they have COPD. So that's the chronic obstructive pulmonary disease. So oftentimes people with COPD start having voice issues for a variety of reasons. These things are good. This helps everybody: avoiding irritants, limiting vocal use, and sipping fluids. So definitely some things you can kind of look at. Treatment. A lot of what we do with treatment of nodules, how do we reduce that vocal strain? And what's funny is one of the main strategies is doing like an easy onset. So as we do in stuttering therapy, we kind of work on how to ease into it so it's not so hard. And it's kind of like using that H. So the H sound is a nice, easy fricative, some air going before we go into the word, kind of softens it. And sometimes people have to have surgery. So obviously biggest part of therapy for voice is, working on that vocal hygiene, which really talks about, eliminating vocal abuses. And stress really can impact it too. I think all of us need help with stress. So you can kind of look through this. There's a lot of stuff. It gives you more of, here's the same things, talk about polyps, cancer, treatment of laryngeal cancer, puberphonia, therapy. Obviously therapy for puberphonia, we should be referring to a mental health person. So spasmodic, that's just one that kind of occurs, and it's neurological, and it often happens, in individuals between 30 and 50 years old. And it seems to be more of a woman heavy disorder versus male, but it can occur in both genders. And vocal fold paralysis. Sometimes we see this after someone who's had a traumatic brain injury. So then I feel that's really hard if someone has aphasia and then now they have all these language issues, and then they also have some, vocal fold paralysis. So definitely sometimes we see voice disorders in comorbid with other things. So definitely can impact people in a variety of ways. So definitely you can kind of hear that. And really kind of what we do is we really kind of work on increasing the breath support, maybe positioning. These are things too where, depending on the severity of the paralysis, kind of working on that pitch alteration. And I'm not the best with some of that, but definitely what we'll do a lot with, depending on which side that the paralysis is you might have them turn one way or another to kind of stabilize and get some movement with the vocal folds. So definitely there is some things we can do at the neck level to help increase our ability to voice with some of that paralysis, depending on the severity of the paralysis. So that's always the other key piece. Is it might not be that severe for one person, but more severe for another person, so that some of those strategies might not work. So yes, so the treatment of spasmodic dysphonia, and I haven't seen anything else, but it's Botox. So Botox does help spasmodic dysphonia. So definitely sometimes we see some intermittent issues related to the Botox. So definitely some ongoing treatment, and it's a collaborative approach again with a medical professional as well as you as a therapist. So those are just some of those the main part that we work on. So be familiar with that. So SLPA, this is our last slide tonight. I mean, typically speaking, in a pediatric setting, we're providing kind of what I would call minimal voice therapy. A lot of vocal hygiene, a lot of working on reduction of those abusive behaviors. And that kind of goes with awareness. What's a good replacement behavior? Okay, every time you want to, do this with your throat or make this noise with our voice, what's something else we could do instead of? We've seen a lot of cheerleaders have this issue. We always need a full ear, nose, and throat specialist report before we do what I would call voice therapy. And I say voice therapy. We need clearance to provide therapy for someone with a voice disorder. And that clearance is by an ear, nose, and throat specialist. And then typically speaking, your SLP should be able to assist you with therapy activities, since she will help determine the course of treatment. And, when in doubt, always ask your supervisor. So there are kids that do things. So for instance, I do have a particular client with autism, and we see this, you'll see this a lot, is they might make these noises that are trying to, what I would call, fulfill a need, a communication need. And we know that that can be very damaging to the vocal folds. We know that it could cause a lot of other issues. So we work with families on, hey, they're doing this sound that's not good for a voice. And what are some other ways we can support that communication piece? So definitely that's in our clientele with autism, as well as some other disorders too. We see they're using this voice stuff to communicate. So we really want to work on what's a better way to communicate. And then somebody I know, my SLPA, we had this kind of come up, and she's like, well, am I treating the voice disorder? I said, no, we're not working on how to optimize his pitch or do any of those things. We're really working on what's a replacement behavior for the communication need that this sound is kind of doing. And that's not going to get, kids, your mom and your teachers and, maybe your siblings attention, but that might not necessarily get the attention from someone who doesn't know him. So what's a better way to do that? So if you're in doubt or you're unsure, always talk to your supervisor about the purpose of the goal, or, why are you working on a particular skill with a client. So any other questions? So there is this week, we have an observation, and I will double check that that's still on Master Clinician. And
I think it's still on.
Is it there? I didn't check. I should have checked. I usually check before the semester goes, and I haven't. And then we have an assessment. So definitely be familiar with some of the voice disorders. What are some of the basic treatment things we do, as well as the vocabulary. And then on the read and review summary, so you're asked to treat an adolescent client and work on teaching the client vocal hygiene. So obviously this client has seen an ENT, they've cleared them for therapy, they recommend therapy. So your supervisor gives you this client, an adolescent. So we're looking at, teenager. How are you going to teach this teenager how to take care of their voice? So what are kind of the key pieces? Let's review. Drinking water, reducing, places where you yell or engage in vocal abuse behaviors. If you can't avoid those situations, what are other ways you can do to manage it? Usually it's providing amplification or kind of more behavioral and environmental changes. Teaching the client the benefit of humidified air, running the humidifier at night, even those little ones. I know I run it at night sometimes. They're not real, not like the big ones, but I think it helps to put a little, especially in Arizona air, gosh, little extra moisture might be helpful for your skin too. And just, so basically what I'm looking for, not necessarily a treatment plan, or I'm just like, think of like a couple different ways you would address this with your adolescent client. And I'm just talking about some more generalities. I'm not talking about specific things for a therapy session. If you want to, feel that's fine. But I'm really looking at what am I going to talk about? I'm going to talk about in a vocal hygiene sense. What am I going to work with this client? What are some of those environmental factors? Do they recognize when, a lot of times too, we're working on awareness. Do they recognize when they're engaging in these behaviors? So sometimes some of our clients don't realize when they're engaging in these abusive behaviors. So we kind of have to work on that self-awareness piece also. So any other questions? If not,
Well, I do actually. Sorry.
Yeah, go ahead.
On the instructions for the assessment on this one, it does say we can use a card. So is that
Yes.
not a, okay, my eyes aren't deceiving me. Okay.
Does it say if you can use a card? Yeah, I was like 212 is different than 215. So I also have to like specify which class am I talking to. If you want to, if you can use a note card on the quiz, it'll say it in the directions for my classes anyway.
Thank you.
Alrighty. Okay, thank you guys.